Joseph Del Castillo.
Nice to meet you, Ziad.
Glad to have you on board.
Thank you so much.
Glad to have you on board of the FPC. I'm really excited to have this podcast with you. Would you tell us a bit about your background first?
Sure.
Just introduction to the audience.
Yep, I grew up in Toronto. I bleed blue. I love the Toronto Maple Leafs. Played hockey. Love to ski. Love to snowboard. Moved to the U.S. in high school. Went to medical school in the Caribbean, and then decided to pursue business. So I went to George Washington University for healthcare business, and then pivoted there just because I learned a lot, as well as made some connections. I went to Hopkins to finish up my population health certification.
Nice.
Yes.
Very nice.
Thank you so much.
Path.
Thanks.
So with your extensive background in healthcare, can you share your insights on the current challenges facing healthcare financing and policy?
So from a personal perspective, I feel that healthcare is actually really going in the wrong direction. Since I've been practicing for the past 20 years, I've noticed significant changes. Ones that where if I go out to see a patient in my program, community paramedicine program that I developed, you see how these people are living and how they actually cope. So what I look at the challenges is the government and policies don't reflect the upstream, the people themselves.
Interesting.
You go to, so there was one patient that I went to go see just because she was continuing to go to the emergency department with COPD exacerbations just every summer, not in the wintertime. And we actually went to her apartment building, and there were actually bars at the windows, so she actually couldn't even put an air conditioning in.
My goodness.
So what we did was we talked to their insurance company and said, look, in order for her not to, use all her premiums and deductibles, let's put a floor air conditioner in so that she doesn't, utilize the ER or frequent fly the ER all the time. So that's one of the challenges. And then another challenge is just prescription drug medications. I mean, back in 2014, 2019, prescription drugs rose 33%, more than inflation, which was, 8%.
Amazing.
I mean, I am worried about what the government's actually doing to the rural population. I mean, if they closed 138 rural hospitals since 2010, how are any of those people getting, health care? I mean, there's a saying that I learned in for population health. I mean, 1 in 4 can't afford, 3 in 10 stop and hoard. I mean, 1 in 4 Americans can't afford medications, and 3 in 10, sometimes they say, you know what, I'd rather pay for electricity, I'd rather pay for gas, I'd rather pay for my car, because I can't, then afford medications because I need to get to work.
So what do you propose should be done?
They basically need to adjust, varying regulations and policies between states.
What do you mean they? Who, the government?
The government, absolutely.
So how do you see emerging technologies influencing the future of healthcare delivery and its cost?
Emerging technologies are going to disrupt healthcare. Let me give you an example for wearable technologies.
Yeah.
I had a patient who actually just came into the ER. He was in his 50s. He actually was wearing the iWatch. And the iWatch basically said, you are in atrial fibrillation. And so he actually came in. So if we're thinking about more preventative care versus, trying to treat chronic diseases, I mean, you're going to save so much money that way. So and another thing about technology is for our diabetic patients, we have continuous glucose monitoring. So these continuous glucose monitors, what they do is they continuously have feedback to the primary care doc, so that they can actually look, is his blood sugars okay? Do I need to modify his insulin now? Can I start him on Farxiga, or can I start him on a different type of medication that, can prevent him from having, strokes or heart attacks because of his diabetes? Telemedicine. I do think telemedicine is going to disrupt healthcare. Especially in those rural populations where the closest critical access hospital for them is about 45 miles away.
Yeah.
This allows for physician and providers to continue to keep continuous communications with each other.
Yeah.
And it prevents them from unnecessary visits to the emergency department, even hospitalizations, especially for our diabetic patients.
Mm-hmm.
Even for our cardiology patients, like I said, there was the iWatch event there, when the patient had an alert on his watch. Well, for stroke patients, we also have loop recorders. Loop recorders are also continuously fed back to their primary care or your cardiologist. And they'll let them know if they are going into an abnormal heart rhythm so that they don't have a heart attack or stroke. Bring them into the hospital, either put a pacemaker in or do an ablation. So,
What strategies would you recommend improving the financial sustainability of healthcare systems while maintaining quality patient care?
I think that's a great question, Ziad.
Thank you.
I think we need to transition really from fee for service to value-based care. Value-based care is like, you know, giving my son an allowance and says, this is how much money you have, figure out how you're going to spend it properly. And then we'll
Interesting.
translate that to, total cost of care model, which Maryland's using. So they basically said the same thing. That they took a look at data a while ago from, revenue services, and they said this is how much it costs to take care of these high-risk patients.
Uh-huh.
We're going to give you a lump sum, but you're going to make them better. And so I think, going from fee-for-service to value-based care is one way that healthcare can be sustainable and transformed.
Very interesting.
What we want to try and avoid is fee-for-service, because that is, what the doctor did for you. Did that improve your health?
Mm-hmm.
Are outcomes, addressing that? So that's where value-based care comes into play, where the physician is accountable for health outcomes.
So, can you discuss the role of public and private partnerships in advancing healthcare innovation and accessibility?
Yeah, I think that's a great question. Partnerships using private equities, they have capital. They have organizational, operational expertise. So getting government services involved. This is just like what happened in COVID.
Yeah.
Why we got the vaccine turned over in less than a year.
Yeah.
We had government, we had health services.
Public-private partnerships.
Right, correct. We had investors, and then we had, people. And I think trying to make policies more flexible so that this can happen not only in emergency epidemic situations, but correlate that to, chronic diseases and ways for preventative medicine to flourish.
And do you see this trend going on again?
Oh, it's going to happen, especially with emerging technologies like artificial intelligence. I mean, that industry plus healthcare is hopefully going to decrease health spending from our $4.5 trillion and, utilizing a GDP of 20%. That's crazy.
Interesting. So, in your experience, Joe, how can financial policies be structured to address disparities in healthcare access and outcomes?
So when you talk about disparities, there's racial inequalities,
Yes.
there's socioeconomic status issues, there's geographic barriers. I mean, if we're going to talk about racial inequalities, why is a 50-year-old black man dying of heart disease, a higher rate, 30% more than white? Why are black infants dying more than white? I mean, this is where we have to address and go upstream and figure out the reasons and the root causes why. I mean,
what do you think are the reasons?
I think some of them are because of socioeconomic statuses. I think if we're not middle class, you don't make money. I mean, that's a big deal. So it's a lot of bias.
As a concluding remark of this talk we're having, what do you have to say?
I think the challenge is with finance and policy that need to be changed are related to cost, decreasing access barriers, and trying to change inefficiencies.
It's a balance between doing good and being profitable. You can't go, you have to make money. That's how you have to live. And also at the same time, you can't abuse this, just being a profit organization. So how would you balance this in a couple of words for you?
What I would probably do is leverage private equity firms to kind of help me out. One of the reasons is because they have the capital and they have the operational expertise. There is a mismatch between you know, the growing needs of our population and the ability to access care. So why not use an outside source?
That's a very good answer. Anyway, thank you so much for your time, Joe. We hope to see you soon again, and welcome on the board of the FBC. Thank
Thanks,
you.
Ziad.
Thank you.